today we're going to do a really short video about the common symptoms of ADHD. I'm joined by my friend and colleague Lauren, who's a forensic psychologist working with Attention to Health. And we just want to talk about the common symptoms of ADHD in order to provide information and see whether you might notice any of these symptoms in yourself.
Yeah, and I think something we see really frequently in our clinical practice is there's adults who've struggled for years without realizing ADHD might be part of it.
Yeah. So ADHD has always commonly been associated with sort of childhood, particularly kind of like the little hyperactive boy. But we know now that it persists into adulthood, and the presentation can actually look very different, which is why it can be frequently missed or misdiagnosed as another condition.
Yeah, exactly. And many adults assume ADHD would have been picked up earlier if they did have ADHD, but that's not always the case. And I think particularly those who've developed coping strategies or didn't fit the stereotypical presentation. I think sometimes we hear, oh, someone has to be bouncing off the walls, they must have ADHD, but perhaps it's people who maybe don't meet that kind of presentation that you assume maybe don't have ADHD.
Yeah. So, Lauren, could you kind of outline the main presentations that we see for people with ADHD?
Yeah, sure. So we've got 3 recognised presentations. First is inattentive, second is hyperactive impulsive, and the third is combined. So for people who have a predominantly inattentive presentation, we usually see difficulties with things like organisation, sustaining attention, and forgetfulness. And then with a hyperactive impulsive presentation, in adults, this might appear as internal restlessness, so difficulty relaxing or a tendency to interrupt or act quickly without thinking. So that could be like blurting things out, finishing people's sentences, lots of things like that. And then a combined presentation would be someone who has features of both. So it's actually quite common for people to have a combination of the two.
Yeah, I noticed particularly a lot of adults tend to meet the sort of inattentive and combined sort of presentations. I think hyperactive impulsive is usually the rarer ones, but I've seen all 3 in my clinical practice.
Yeah.
So how would you say these kind of sort of symptoms sort of tend to differ between sort of an adulthood and a childhood presentation?
Yeah, so in adults, ADHD is often less about visible hyperactivity. So like I said before, it's usually about those internal experiences. We're not necessarily going to see somebody bouncing off the walls or presenting as having lots and lots of energy necessarily in adults. Instead, it's about internal experiences and executive functioning difficulties. So that might include things like chronic procrastination, difficulties managing time, or feeling really overwhelmed by everyday tasks. And I'm talking even like basic things like doing the laundry. It could be like stacking the dishwasher, things that feel just absolutely overwhelming to people. That's usually that would be a presentation that would suggest some difficulties with executive functioning.
Yeah, and not just in times of kind of high stress either, just all day, kind of every day.
Yeah, absolutely.
One thing I've always noticed that we hear about, it can be really common in adults for that presentation to be quite inconsistent. So people who can be really capable in some areas of life where they're maybe able to really sustain that sort of focus, but for sort of very set sort of periods of time, but then completely unable to, or may really struggle with maintaining sort of routine and that kind of overwhelm, or be able to sort of follow through on plans.
Yeah, exactly. And what you're describing there is basically very, I suppose, related to masking. And masking is kind of a term that we use where somebody is kind of trying really hard to behave in a way which they think they're supposed to behave. So this, I suppose, kind of just trying to suppress maybe how they might naturally behave, which can try and hide the difficulties. But this comes at a huge mental cost. It can be really exhausting and draining for people to constantly try and act in a way which they think should be how they are meant to behave, I guess.
Yeah, in some ways you could have just called it sort of like a coping mechanism, but as you say, one that comes with just this huge mental effort at the same time.
Yeah.
What are some of the common like day-to-day experiences that you might see or do see in adults with ADHD?
So something we see quite a lot is, I suppose, starting multiple tasks without finishing them. So say if someone's like cleaning the bathroom. They might start cleaning the bathroom and then they see something in another room and they're taken away and they immediately start doing something else. So it's about engaging lots of different things without finishing them. Misplacing items, it can be like keys, phone, wallet, anything. It's like, I don't know where I've put that. They've put things down, or people try to have strategies because they know that this is something they really struggle with, or completely avoiding tasks that require sustained attention. So things that feel like a lot of mental effort, some people might try and avoid. But we also hear, because that's me.
I was just thinking, but not just things that are kind of really boring or something like that. They're things that most people would be able to do without much effort at all. It has got to, I think, for to meet the criteria for ADHD, like something that really most people would be fine with, but for them it just feels like walking through treacle or something.
Yeah, totally. Even things like, I suppose, like replying to text messages, or like something like reading, things that like day to day people shouldn't really struggle with that much, but for them it can be really difficult. And we also hear about people relying on pressure to complete work. So you hear, I only work well under pressure, I have to do things last minute. And I guess like things around like ongoing difficulties with organisation, despite having really good plans in place, these things, when they kind of it comes to crunch point, they're not able to implement them. So you see it a lot in like university students where they are up until like 4 a.m. the night before a deadline is due, despite knowing that the deadline has been there for some time and being like, I'll do it tomorrow, but never really getting around to it until the pressure is there.
Yeah. I mean, I think something that I see is people can often really attribute this to just like, it's just my personality to say kind of procrastinate and things like that. And for some people it can be, but if you're trying to like put together a picture of all of these things, I think it becomes a bit more than sort of just personality and really needs to be seen in a sort of neurodevelopmental kind of context, particularly if these are sort of things that maybe people have tried to work on, but yet just can't sort of change really.
Yeah, absolutely.
So when might someone kind of consider sort of seeking an assessment for ADHD?
So we'd expect somebody to seek an assessment if these patterns have been present over a long period of time, and if they've been having, I guess, a meaningful impact on daily functioning. So we'd want to probably see difficulties in some areas of life. So that might be work, it might be relationships, managing responsibilities. It wouldn't have to necessarily be all of those, but you'd want to see them in a few different settings. It could be daily, doing daily tasks, anything like that. We just want to see it within a few different contexts, these difficulties getting in the way, and I suppose you noticing that it's causing a difficulty for you.
Oh, well, I think you've taken us through that really comprehensively, Lauren. Thank you so much for your time today.
Thank you.